Hello, and welcome back. I am talking about why riding a bike now is okay when you can't walk because of your knee pain. So many people, and I'm assuming you included because I hear it so often, you've been told that you need to walk more for your health. Or maybe my absolute favorite, walk for 30 minutes a day and you'll feel better. And most people who have knee pain are like, how can I do that? So many women I've worked with as clients, I've talked to through my private Facebook community or know me personally have told me their doctor just says, walk for 30 minutes a day. That will get rid of their knee pain. It will make their knees stronger. And that's what they need. Need their knees stronger. But most women who have the knee pain can't walk that long. They can't do that amount of time without taking a break or just flat out can't do it. So, what are they supposed to do? So, if you can't walk 30 minutes, you could build up tolerance over time. So, you walk a little bit. Let's say you can walk 5 or 10 minutes. You do that a couple of days a week for a week. If that felt okay, you can add 10% the following week, do that a couple of days. And by a couple of days, I mean 3 or 4 days. So, like every other day kind of thing. And that's safe and it's effective to increase by 10% each week. So then you can eventually get further walking. But what if what if they still can't do it? Well, you can ride a bike instead. And I've said this to some people, some clients, and just, some people I personally know, and they're like, well, that's not going to get me to walk farther. No, practice like you play. No, it's not going to immediately make it so that you can walk farther, but it's going to exercise your legs. It's going to put less pressure on your knees than walking would. And it takes less energy to go the same amount of time compared to walking. So let's say you ride your bike for 10 minutes, the energy expenditure from your body is less than that 10 minutes of walking. So you might be able to tolerate more and then build up more strength, build up more motion, get the circulation going, get the swelling out, get the fluid that lines the joints swishing around those joints better. So less energy. Let's talk about each one of these. So less energy to ride a bike than walk the same distance. Because of the mechanics of using the bike versus walking, your body won't use as much energy to ride the bike as it would to walk the same distance. This makes riding a bike a lot easier. And so many people who can't walk those same distances can exercise by riding a bike instead. So if you have trouble walking because you get tired easy or you don't have the strength to walk the distance you want, try riding a bike instead. You can ride the bike outside. You can go to the gym on an upright or a recumbent bike. You can get one for home. If you also have back or hip pain, you might find that getting a recumbent bike, the kind with the seat back, is more comfortable than the upright bike that just has that regular, banana seat and nothing to lean against. So that's the energy expenditure. And then riding a bike puts less pressure on your knees compared to walking as well. So one of the benefits of riding the bike, if you have knee pain, is that if you have the range of motion to pedal the bike normally, go full circles, it can be less painful to ride that bike compared to walking. Because when you ride a bike, you're sitting. And so there's less pressure going directly through the knee. It has to change mechanically, the position your leg is going in, so you're not putting all of that step pressure through. And then you get to control the amount of resistance on the bike. So if it's too much resistance, you just back down and, put that lower level on. And you can control how much pressure you put on that knee. It's connected to your other leg. So if your other leg's pretty good, you can propel a little bit more using that leg than the sore leg. And then over time, you use more of the sore leg because it's less sore, it's stronger, it has more motion, it has better circulation, the swelling is gone. So many added benefits of riding that bike. And then just in general, riding a bike is good exercise. It, like I just mentioned, it helps with circulation, it helps with mobility, endurance, strength, flexibility. If you're riding a bike with two wheels outside, you can work on core strength because you have to stay upright on that bike. It can help with stability and balance to maintain that upright position. And then if you're, at the gym using the recumbent bike, obviously you're stationary. You don't need to use your core to keep that bike upright, but it can improve the flexibility of your knee. It can improve the mobility, give you more range of motion. You can't go full circle around the pedals because you don't have good motion. You just rock back and forth. And then usually after about 5 minutes of rocking back and forth, the knee is loosened up and you can do bigger circles. You can also push the seat back farther so that you have more room. So, like I said, less pressure on the knees, you get better range of motion, get stronger knees and legs, you can get better circulation. And, giving yourself that better range of motion, if like I said, if you can't do that full revolution yet, just rock back and forth. You can get stronger legs by increasing the resistance. So you can really get those muscles working to really push through. You can get an aerobic activity by having less pressure going faster, less resistance and going faster, which then can help the circulation in your legs because you're using those muscles, you're using the legs. So that automatically makes the circulation have to pump a bit more in the legs. Okay, so let's recap. Riding a bike is 100% okay if you can't walk because of knee pain. Riding a bike takes less energy than walking the same distance. Riding a bike puts less pressure on your knees compared to walking. And riding a bike is a good way to exercise your legs. You can improve your range of motion, strength, circulation. And so when you want to exercise but you can't walk, choose a bike instead. You can ride it inside or outside. You can ride a recumbent bike, an upright bike, your choice. It's all good exercise. Okay, that's all for now. I'll talk to you later.